Knock, knock. Hi, how we doing in here? Good. Well, it looks like we're ready for your discharge. So I've got a book here. I'm just going to go over some of these high points of your discharge, make sure you understand some of this stuff. This book is for you to take home. You can see there's lots of information in here. Most of the information I'm going over is covered in this book. So I want you to read this at home. While I'm going over it, if you have any questions, feel free to stop me, okay? All right. So, how are you and baby Sophia doing? Good. Well, it looks like everything to this point has been uncomplicated. Everything's gone great. So, congratulations. Uh, you you did have a vaginal birth. You had a small tear at your birth, so you've got some sutures down there, as you know. Taking care of these sutures, you're just going to want to try to keep the area clean and dry. These sutures will dissolve on their own over time, over a week or two. So no need to follow up to get those taken out. If you have some pain down there, you can ice it. I would use ice packs, no longer than 20 to 30 minutes. Make sure and wrap it in a towel or something. You don't want the ice directly on your skin, okay? Um, as far as bleeding, you can expect some discharge over the next few days. Hopefully, you won't have any bleeding from your tear, but if you do, you probably want to follow up with us. If you have bleeding that saturates more than a full pad or a gush of bleeding, go ahead and call back or come in instantly. Okay. With your bleeding, you want to make sure and look out for any foul odors, smell of infection, any strange brown discoloration. Those are some signs of infection, and you're going to want to follow up with us. As also, fever. If you're running fever, a small fever is going to be expected over the next day or so. After that, if you're still running fever, or if your fever really spikes, definitely come back in or call, and they may want to put you on some antibiotics. Let's see. As far as the pain, I told you about the ice packs. You can also take some warm sitz baths a couple times a week. You can use some over-the-counter pain management, ibuprofen, Tylenol, okay? I don't think they sent you home with a prescription for anything. All right, let's see. We went over the blood loss. Perineal care, you've been doing it. We've already taught you how to do it here. Keep the area clean and dry. Use washcloths to clean it around the area. Sex practices, no sex until you get to your follow-up appointment. This goes for vaginal and anal. We don't want anything else to tear down there, especially with the laceration already there. Just abstain until you get to your follow-up appointment and get cleared by your doctor, okay? All right. Any questions so far? Okay. As far as newborn care, your baby's doing great. She's latching. She's feeding great so far. Feeding like a champ. Continue. I know you're breastfeeding. If you have any issues, you can follow up with us. We can get you with a lactation consultant if you start having issues. There's also there's resources out there, some support groups. As far as that goes, maybe you want to make sure your baby's feeding every probably 2 to 4 hours. Some weight loss is expected over the first couple of days, but then if they're continuing to lose weight and not feeding well, you want to come back in or follow up with us, okay? Safe sleep practices, and we've talked about this before. You want them on a firm mattress in a crib or bassinet by themselves. No blankets around them, pillows, stuffed animals, anything like that. We don't want them to have anything that they can suffocate on in their sleep, okay? You're going to want to watch out for jaundice, which is the yellowing of the skin, yellowing of the whites of the eyes. Sometimes the bilirubin level can go up in newborns and they can develop some jaundice. Some mild jaundice isn't too bad, but if it starts getting more severe, If you see it at all, just go ahead and follow back up with us, okay? Let's see, a couple more things. Car seat safety. We can't really do much as far as helping you with your car seat. Technically, this car seat certified technician should be helping you. You can go to some local fire departments or police stations. Some of them have technicians that can help you make sure all that's installed correctly. I'm going to recommend following the manufacturer's directions on that. Look up a video for it or something like that. As far as the straps go, you want them to be at the level of the shoulders or lower. You don't really want them to be like up higher than the shoulders and having space in between there. You want the straps to be snug with the breastplate right here about nipple line to the top of the armpits. Maybe like 1 finger breadth underneath the straps, and that's it. Okay. Another thing I skipped over this, but making sure your baby's airway is clear. You have the bulb syringe, mouth first, and then nose. You don't want to get the nose juices and snot up in their mouth, okay? But anytime they're having some drainage and stuff like that, make sure that airway's clear, okay? All right, any questions so far? Okay, there's a lot more stuff in here. Baby behavior. Looks like your baby. No, never mind. Okay. Skin to skin contact. That's important. You've been doing that already here, but that'll help keep her warm. It also helps with bonding. It's normal for your emotions to be all over the place postpartum. So you can have a little bit of the blues, some sadness, some crying, some just out of whack emotions as your hormone levels are trying to get back to regular. If you do have any persisting depression or anything like that, contact us. We can get you with a counselor, a therapist, get you with some support groups. Just make sure you reach out, okay? All right. Any more questions? Okay. Well, take this home with you. We're going to get a wheelchair in here for you, get you out of here. I'll be right back with your paperwork to sign, okay? All right. Bye.